Breast cancer is the leading cause of cancer death in women, and the BRCA mutation has a fundamental role in breast cancer. In some patients, it predisposes them to get cancer, and the patients that are BRCA mutated effectively have tumors that don't behave exactly the same way as other tumors.
In some circumstances, the BRCA status may influence some decisions in a cancer treatment. The presence of a mutation allows also relatives to do genetic tests and then adapt their own surveillance based on their own BRCA status. And in recent years, the BRCA status has been shown to be useful to determine whether a maintenance treatment by PARP inhibitors is needed or not. Traditionally, this kind of test was performed after a genetic consultation. It can be very lengthy to obtain an appointment. And the analysis by itself is time-consuming with a turnaround time that can span over a few weeks or months. These type of tests are really expensive, and the interpretation of the results may be challenging. Genetic tests is useful only when a mutation is found, and most of the time it is very low, less than a few percent. It means that you need to test a lot of people to find one mutation. The BRCA test is not indicating for all breast cancer, but we can say that probably the vast majority of women who should have the test don't receive it.
And this is a lost opportunity for these patients to benefit from treatments that are adapted to the makeup of their tumor.
Pathology has a central role in identifying patients that may benefit from BRCA testing. We can recognize specific morphological and molecular features that raise the suspicion for BRCA-associated cancers.
AI may help us to determine and distinguish women for whom the probability to find a mutation is sufficiently high to make genetic testing useful.
BRCAura is a digital pathology AI test for breast cancer patients. In practice, what it does is the software screens the digitized H&E diagnostic slide and can identify the patients that are either not carrying the BRCA mutation, or on the contrary, highlight the ones that are very likely to be carrying the BRCA mutation so as to send them to subsequent confirmatory testing.
Pathologists could incorporate it as a reflex test during the initial diagnosis, and that cuts the turnaround times by far and ensure that the information about the BRCA alterations can be incorporated directly as a frontline diagnostic information. In practice, it gives us an additional rapid access point that can guide genetic testing choices and ultimately making precision oncology more efficient and reliable.
We're first releasing BRCAura as an RUO, which means research use only. The objective is to have use of BRCAura in clinical research settings so as to understand the impact of BRCAura on precision testing today. In parallel to this, we're working on certification of BRCAura so that it can ultimately be used in a clinical routine setting.
Ultimately, the combination of digital pathology and AI is not just a technological upgrade, it's a paradigm shift for the role of pathology as the cornerstone in precision oncology.
Through the use of BRCAura, what we hope is to increase the number of patients that actually get screened using AI and to effectively increase the number of patients within those that then benefit from confirmatory BRCA testing and then basically can benefit from care strategies that are adapted to their tumor.